Okay, good day, everyone. Welcome to our first webinar, IOHA's first webinar of the year. We are very grateful to have Sally North from Western Australia here with us today. And I would like to thank all of the participants for joining and also Sally for taking the time to share her expertise and her experience with us. There is a Q&A box. You'll see a little icon at the top of the screen. And so please do put your questions in there and we'll have plenty of time at the end to go through the questions one by one. If you would like to unmute and explain a little bit more or ask a specific question, I can unmute you. So please just pop in the chat or the Q&A that you would like for me to unmute you for your question, and I can do that. IOHA, and I think many of our member organizations recognize that Australia is setting a global bar in some of its prevention and protective approaches to worker health and hygiene and safety and well-being. And so we very much look forward to listening to Sally. We also look forward to hearing about some of the work that's underway and that's been accomplished in the areas of policy and partnerships in Australia. And we think this can serve as a model for other jurisdictions. So as you listen today, please be sure to write down any questions that you might have for Sally at the end. And those might look like questions regarding where your jurisdiction can get started or what can be achieved. And then maybe some, suitable or reasonable timelines based on where your jurisdiction is currently. And so Sally might be able to shed some light on some of those questions for you or any others. So I'll introduce Sally and then I'll hand it over to her. Sally North is WorkSafe Commissioner in Western Australia. And in this role, she is the work health and safety regulator for the resources and general industry sectors. Commencing as an inspector before leading WorkSafe's occupational hygiene team for some years, Sally has over 20 years experience at WorkSafe in operational and leadership roles. She is involved in state and national committees and working groups on work health and safety, and she has qualifications in chemistry, occupational hygiene, occupational safety and health, and business administration. Sally values the opportunity to make a difference to the community through WorkSafe's education, support, and compliance teams, and through collaborating with stakeholders. And so with that, thank you very much, Sally, for sharing your time with us today, and I'll hand it over to you.
Thank you, Samantha. Let's confirm that I've shared some slides there that hopefully everybody can see.
Looks good.
Hello, everybody. Thank you. And thank you for joining me today for this presentation and our question and answer on an approach to policy and partnerships as we practiced in Western Australia. And I hope it might help you consider what approaches might translate to the jurisdiction you're working in or update you if you're actually from Australia. I'd also like to acknowledge the traditional custodians of country throughout Australia and specifically the Whadjuk people of the Noongar Nation on the lands where I'm joining you from today and recognise their continuing contributions to land, sea and community. I'd also like to extend that respect to Aboriginal and Torres Strait Islander peoples present today and to First Nations peoples around the world. So in the webinar, I'd like to discuss some of the worker health challenges that we've been working on in Australia and the policy and partnerships that have helped us to do that. I'll also outline the major participants in that space in the national scene as well as in the state of Western Australia and address the issues that have been a larger focus for us recently. I will reflect on what has been working well for us and how other jurisdictions might consider applying models of this type for them. So in terms of national challenges for worker health, there's a few numbers here that we can have a think about, and they're not insignificant. We're looking at thousands of cases of cancer per year related to work and hundreds in terms of cases of silicosis that we're aware of, not per annum, but in terms of recent exposures that have led to silicosis, thousands of deaths per year from asbestos, and some risk factors that are contributing to ongoing worker health issues. So while I've provided those numbers to help us get a sense of the challenges, it is hard to get firm estimates on some of these issues. And certainly there's limitations to the studies that have led to this, but it really highlights that it is useful to get that kind of information to help us understand risk and help us understand where we want to focus. So Safe Work Australia, a national policy body here, has reported that around 1.5 to 3.6 million workers, or 20 to 40% roughly, in Australia are potentially exposed to occupational carcinogens, including hazardous chemicals. Back in 2006, it was estimated that around 14% of cancer deaths in males and 2% in females were associated with occupational exposures. And that's where some of these estimates for cancers actually comes from. Additionally, this doesn't capture the non-melanoma skin cancers, of which there are many thousands every year in Australia. Many people may be aware that we've had a big increase in silicosis, and in Australia that's largely been noted since around 2017. And a big component of that has been exposure of workers to processing of engineered stone. So the stone that's used in it's been hugely popular in Australian kitchens and bathrooms and buildings of other types. So it's been a big contributor to that. So that's where a lot of that comes from, but we also see silicosis from other sectors as well. In terms of asbestos, Australia's been a big user of asbestos historically, although it's now been banned for some decades in terms of new uses. So the estimates of around 4,000 per year relate to approximately high 600s to 700 deaths per year of mesothelioma, which is, we've got good information to suggest that's largely from asbestos exposure, but there's also estimates there contributing to the 4,000 of lung cancer and other asbestos-related diseases. Of the asbestos that we've used in Australia in the built environment, we've estimated that perhaps 40% of it is still in place, so we've still got a lot to deal with. And we also have asbestos materials in our naturally occurring minerals, and that can be an issue when we mine materials, that we've actually got to identify naturally occurring asbestos and manage the risks of that as well. Emerging issues, we do have climate change identified in the National Safe Work Australia Work Health and Safety Strategy, and noting that not only the risks from heat, but other extreme weather risks are increasing human and animal proximity, are contributing to risks of novel diseases as well. And as I speak here today, WA, Western Australia, is having a bit of a heat wave. And of course, we've seen the tragic situation with fires that have occurred in the United States in recent times as well, which really, to me, are indicators that we are seeing risks change associated with climate change. When we look at worker health, we're also focusing increasingly on workers' mental health. And estimates of the cost of poor workplace mental health do vary, but certainly in Australia, they're all large estimates. We're looking at a substantial issue. It's reflected in substantial workers' compensation figures nationally. And the trajectory for these in Australia is upwards. We've seen that trending upwards. So far, we haven't seen that plateau or come down. So we do have a level of urgency about introducing effective and evidence-based measures to mitigate workplace risks to mental health. On a related topic, international surveys are showing that Australian workers are self-reporting high rates of burnout. So when we're looking at self-reports of something like burnout, and workers might not necessarily be aware of the clinical kind of definitions of burnout, so there's some levels of accuracy to figure out when we've got those self-reports. But at the same time, when we're leading those international surveys, it does show that we've got some specific stressors for Australian workers, and we know that Australian workers are also working in many cases quite long hours. Our hours of work are really quite high, and that may be part of that equation as well. So just in terms of the influences on the national scene for worker health in Australia, there are many influences, and I'm just going to highlight some of those. Firstly, we've got work health and safety ministers. So there's ministers from each Australian jurisdiction, and I'll talk more about what that looks like later. The ministers meet up several times a year. They make strategic decisions in relation to work health and safety issues. A big one that they recently decided on was the decision to ban engineered stone. And having decided that among ministers at a national level, we were then able to take consistent national action to bring that into place. I've mentioned Safe Work Australia a little earlier. It's a national policy body, so it's not a regulator, but it's a policy body that works to improve work health and safety arrangements nationally. The Safe Work Australia Council is a tripartite body. It's got an independent chair, a jurisdictional regulator representatives, it's got union representatives, employer representatives, and representatives of the Safe Work Australia agency. They do publish their operational plan on a regular basis so people can see what they're working on. And some of the things on the radar at the moment are implementing or finalising the implementation of the ban on engineered stone and making sure that that's checked to see that it's working effectively. Additionally, there's been new and tighter silica laws that's on the radar to make sure that those are working and that there's adequate national model guidance available for that. Safe Work Australia is considering information around the need to notify regulators of specific incidents and types of work health and safety issue. Further guidance is being developed, and also, and I'll touch more on this later, they are aware of a need to provide more education and awareness around workplace exposure limits. Safe Work Australia has also produced the Australian Work Health and Safety Strategy, which is a 10-year strategy, 2023 to 2033. So it is a national strategy that jurisdictions have endorsed, and it includes targets such as reducing the number of workplace fatalities caused by safety incidents by 30%, and from a health perspective, reducing the incidence of overall injury or illness by 3.5%. It also has aims to reduce the frequency of work-related respiratory disease by 20% by 2033. Also on the national scene, we've got the heads of workplace safety authorities, call that acronym HOWSA for short. It's a network of work health and safety regulators, and it's intended to promote good regulatory practice, consistency, and connectivity. There are numerous specialist working groups supporting this group in its functions, and that includes a group of government occupational hygiene regulators, or industrial hygiene as it is known in many parts of the world. This networking enables knowledge sharing and helps regulators identify emerging issues and promotes the use of consistent approaches. We've also got a national body called the Asbestos and Silica Safety and Eradication Agency. It was formed back in 2013 to oversee the development and implementation of a national strategic plan for asbestos. And so at that time, it was recognised that asbestos materials are quite complex in the way they're regulated. They're regulated in a workplace setting in a specific way, but they also impact the environment in terms of disposal and dumping. They're used in Australian households. Members of the public may be exposed. There's issues around research, around treatment, support for affected people. And so really it's an issue that needed to be treated more holistically than it had been treated prior to 2013. So the introduction of this agency is a commitment to give it that more holistic focus and introduce a national plan, which I'll talk more about later. More recently, this agency's role has been expanded to include silica within its remit. Another national, I guess it's a policy arrangement, is the National Occupational Respiratory Diseases Registry. So as the name suggests, it will be a registry of diagnosed cases of respiratory diseases. It's run by the Commonwealth Department of Health, so that's at a national level, and it collects data on those respiratory diseases with a focus on silicosis. So this is a fairly new body, and it came out of a 2019 national task force, so something the Australian government ran on dust diseases in Australia. As with many jurisdictions, we have an important body of work being done through our universities. So researchers do have input into our tripartite organisations. They are sometimes called upon to provide input into the work Safe Work Australia is doing or other policy bodies. And of course, they're doing their own research through grants and through the support of the universities or through support of industry. And that is really influential in better understanding worker health risks, particularly on emerging issues. And we've seen a role commence and continue with engineered stone as a specific example. Additionally, we are seeing increasing influence from professional bodies. So in Australia, the Australian Institute of Occupational Hygienists has been one of those that's increasingly well recognised. We've also got the Australian Institute of Health and Safety. So over the years, these bodies have grown in their influence on the broader policy stage here. And of course, as part of a tripartite arrangement, it's important that we're hearing from unions and from employer representative bodies. So these bodies have input to many of the national policy arrangements, not all of them, but they are involved at a number of levels, and they are, again, having their voices heard and are being influential in terms of the outcomes. Just in terms of, for those from other countries, and just to give a sense of what I'm talking about when I say that Australia has a harmonised approach to work health and safety. Australia is governed by the federal government, but also by the state and territory governments. So basically, within the Commonwealth of Australia, which is holistically looking at the nation, we've got 6 states, and we've also got territories. So the territories being the Northern Territory and the Australian Capital Territory. And generally, work health and safety legislation is enacted in each of the jurisdictions, and also for employees working for national organisations such as the Australian government, we have a regulator at the Commonwealth level as well. So it does mean that we've got a level of complexity, and going back 15 years or so ago, there was concern that the jurisdictions were not consistent enough in their approach to the issue of work health and safety, and were making things a little bit complicated, particularly for organisations that work in between different jurisdictions or across jurisdictions. So there was a national agreement that there would be an approach called harmonisation, and Safe Work Australia developed a single set of work health and safety laws, which we call model laws, and they're available for jurisdictions to implement. So each state and territory in the Commonwealth then makes a decision about enacting that. And at this point in time, most jurisdictions have enacted the harmonised laws. The term harmonised is used because it's not, the laws are not identical jurisdiction to jurisdiction, but they're largely consistent. And we've got to keep working on that to keep them largely consistent. And that's a work in progress, because jurisdictions have specific issues that sometimes call for departures from the models. Additionally, as well as the national model laws, there are also national model codes of practice, a national compliance and enforcement policy to promote a consistent use of the laws. And of course, Safe Work Australia was established to organise these things. The Model Act was published back in 2010 and the regulations in 2011. So over that time, many jurisdictions brought in model laws over 10 years ago and around 2012. Western Australia didn't bring them in until 2022. And at this stage, Victoria has not introduced the harmonised laws, although we do find that its laws still have a fairly significant degree of consistency with the model in any event. So overall, we do have this broad framework. While the regulations are reasonably detailed, particularly in relation to chemicals, which will be of interest to some of the audience here, there's also the broad primary duties of care that covers hazards broadly, so that where we don't have specific regulations, we're still able to take a risk-based approach if there's issues at the workplace. So just pulling back to the state scene in Western Australia for a moment briefly, what we need to work with at the state level is we have, of course, a minister that's responsible for the legislation. The regulator that I work for and lead is WorkSafe Western Australia, which sits inside a larger government agency. We work with and need to cooperate with other regulators that we interact with. So just as some examples here, our laws interact with dangerous goods laws, which in Western Australia are a separate set of laws. They may interact with electrical safety laws. They may interact with environment laws, health laws, and of course, at times local government, and of course police have an interaction with us, particularly if there's a death at a workplace. Local government, I've mentioned. peak bodies for employers and employees and for industry as well are important communicators. And as at the national level, we have researchers at the state level, we have our state level professional bodies and union and employer bodies. So within this, we've got a number of arrangements where we formally meet with our stakeholders. One of those is the Work Health and Safety Commission. It's a formal body set up under our Act, and it's tripartite. So we have employer, union, expert and departmental representation, and that body advises the minister. So it's an important thing to keep the minister up to date, especially around emerging issues or things that are in contention, and make sure that the minister's advised of what those hazards and risks are and what the views of this tripartite group are, so that if any regulatory decisions are made, the minister's well placed to do that. And also having all of those groups involved in the commission, it makes really, I guess, a forum for really healthy discussions, because what we're looking at is hearing about the issues that are affecting workers through their representatives and really trying to understand that. And also understand from an evidence perspective what the research is telling us and what might be effective in how to manage that. But hearing from employers as well around issues and risks, concerns and implementation issues, so that when we provide guidance, because the Commission also produces codes of practice for the minister's approval, we're seeking to get something that not only addresses issues but does so in a way that's considered to be realistic and achievable. And that's it really then shows you what is considered to be practicable, which is the bar, if you like, at which the general duty comes in Western Australia. It's what is a practicable way of controlling that. So bringing these groups together is an effective way of doing that. Sometimes, you know, we're having those challenging conversations, but it's worth pursuing, and we do that, I think, in a fairly healthy way. I'm just going to highlight, and other interagencies committees actually sit underneath those peak bodies as well, and we work with those other agencies in that way. I'll just highlight now some of the issues that Australia's been working on in recent times. And I'll start with workplace exposure limits. We've used some different terminology on this over time. Our current legislation is using the words workplace exposure standard, but from December 2026, we will be using the words workplace exposure limit. In doing that, we aren't intending to change the way we're using those standards or limits, but it's just to recognise that those limits are actually called up in the model regulations and jurisdictional regulations, so they do have a legislative standing. So that's what I'm talking about there, and of course they're known by different terms all around the world. As I've reflected in Australia, they are called up in legislation, and not all jurisdictions internationally do that. So that was, I guess, a policy decision taken some time ago that we would put these in regulations. And I think the thinking around that was we do want workplaces and duty holders to take them seriously and to comply with them. And this was considered to be an effective way of getting them to do that. We do have something like 700 plus workplace exposure standards, and so Safe Work Australia, that published them, undertook a really large project to review them. It took some time. There was consultation along the way, and as a result of that, the changes that will be coming into play from December 2026 are on the screen there, but essentially we're looking at quite a number of reduced standards, reduced levels, small number of increases, quite a few amendments, 30 that are just new, only 6 that we were able to delete for reasons like changes in our understanding of hazard, or indeed that a substance might not be used here anymore, and substances moved to the non-threshold genotoxic carcinogen category, which I'll touch on as well. So in terms of the list, we also have notations used to provide a little bit more information about the substances. At the moment, we use a notation around sensitisation. It's SEN as the notation, and going forward, that's going to be divided into dermal. So DSEN will be the notation, and respiratory, so RSEN. So that'll be listed for people's information when they're looking at those standards. And basically, they give better clarity around that issue so that people can consider the controls. We're also introducing an ototoxicity notation. So the ototoxicity notation, which will be OTO, shows that the substance can increase the risk of hearing loss, particularly if the worker is exposed to noise at the same time. An example of that's chlorpyrifos. And I think it's pretty exciting to see that this has actually been introduced as a notation, because we've been, I guess, trying to raise awareness as a regulator around ototoxicity for a number of years now. And we've developed over time some further information. And I think this is the next step, and it really makes it nice and clear. And it also provides a system, because we've started to use this as a notation, that if further research identifies further materials that have this property, we'll be able to use the notation to show that as well. And again, that goes into people's risk assessments when they're looking at risks of those substances. They can consider the noise issue as well and consider whether further controls are then needed. Now, we had previously had a carcinogenicity notation associated with substances that are classified as carcinogens. These have actually been removed, and it's really because the carcinogenicity notifications is explaining about a possible hazard, property and classification. And what this list is more around is around the assessment. So we're not including that one anymore. And additionally, for substances that are non-threshold genotoxic carcinogens, so they basically, we can't see where the carcinogenicity effect starts from, so it could start from a really low level, we're actually not going to have a workplace exposure limit for them going forward. What we'll do with them is they'll be listed separately. Examples there: chromium-6 compounds, PAH mixtures containing benzoalpha-pyrene or dimethyl sulfate, things like that. So we're taking a new approach to that. So it's really going to be an interesting couple of years as we transition towards the new exposure standards. And it's really important that duty holders continue to make sure that they're managing exposures, that they're managing them to the current lawful requirements, but really as low as practicable under primary duties is what they should be working towards as well. And for non-threshold genotoxic carcinogens, that's actually got to be really a focus on, have we got all the practicable controls in place? And things that we might ask ourselves when we're wondering about practicable controls, of course, would go back to looking at the hierarchy of controls. What are the most effective controls? How do we know our controls are working? How can we also, assess exposure of the worker? Are there ways we can do that? What else is being done by other industry participants to manage exposure to substances of this type? So looking around for best practice, those are some of the considerations in moving to reducing exposure so far as reasonably practicable. So the list is available online, and it does represent a large number of changes. It'll be really important for those of you working in Australia that we communicate the changes to stakeholders. That's important for us as a regulator as well. I mentioned it's on Safe Work Australia's work plan, so there's certainly going to be more information coming out about this. And my view is what we're going to need to do is, I've talked here very generally about substances kind of in bulk, and what we're going to need to do as we try to make it meaningful for people is we're going to have to talk about specific changes that are relevant to the specific stakeholder or industry. So while we're still looking at a change that's got some time before it commences, it's an important period of time for preparation and communication. And a little bit further on this, as part of this work that's been done on the exposure standards, there were 9 chemicals that were a little bit controversial in a way, and there was feedback around them, and it was a decision that there needed to be a national regulatory impact assessment conducted. So there was a consultation period for that, for these 9 chemicals, and it closed in December. So I look forward to finding out more about what that feedback looked like and what that will mean for the recommendations. Just to give you an idea of the kind of scale of change that we're looking at, it does vary, but it's in the range of going down to 1% of the level that we've had before, or it might be as high as 50% of the level that we've had before. So it is really interesting. The wells have been intended to provide a health-based standard, but as we all know, we also have to consider technology when we're trying to measure something, because everything's got its limits. We need to consider those limits of quantification, and also we need to consider that if we're looking at workers who are working an extended shift and we need to adjust the exposure standard for that purpose, that may affect our technical capabilities as well. So there can be a tension between those practical issues and taking the health-based approach. So I think it is interesting to consider them from that perspective of what's practicable under the legislation. And I guess on these ones, which are fairly significant substances, particularly noting that silica's on there, and as we all know, that's very, kind of ubiquitous material, this will be an interesting outcome. Carcinogens generally, and the way they're regulated at the moment, there are some regulations under the model laws that address prohibited carcinogens and also restricted carcinogens, and put some particular requirements on how you're able to use those and access those and so forth. But it's a little bit unclear as to how we've identified the specific carcinogens that have been restricted. And so, to my mind, and this is just my personal view rather than an organisational view, it might be that there were some historic elements involved, and there may be the opportunity to look at this more systematically and consider how we can be perhaps a little bit more risk-based in this space. So this is one that, again, Safe Work Australia is interested in and having a look at, and maybe potentially doing some further work. So we're continuing to evolve that. I mentioned silica, of course, several times already, and Australia's been taking a little bit of a novel approach in this space. We did have the hundreds of cases known of silicosis in recent years, and just as an example, in Western Australia, I'm aware of 56 cases of silicosis since 2018. As silicosis can be so debilitating and, of course, potentially fatal. It is a really serious concern that we've seen so much silicosis when it's a disease that we well understand the causes of, and we would really like to have that absolutely not occurring anymore in Australia. But what we found was that the workers that were working with engineered stone were really quite a high risk. We've done some work over a period of time. We've, as a regulator, as did regulators nationally, to try to drive improved compliance, but we did find some barriers. So a lot of small businesses working in this area, not always a strong understanding of the risk, despite attempts from regulators to provide education, a bit of complacency, because the types of levels that we're looking for, the safe levels or compliant levels in terms of silica, respirable crystalline silica in air, are so low that your workplace might actually look pretty clean, and you might feel that you've got systems in place around it, but actually there might still be exceedances and exposures and problems. So it wasn't easy for small business in particular to have those really robust, reliable, well-maintained systems, have fit testing for workers, have really strong hygiene, have systems around, managing dust, slurry, and workplace cleanliness, hygiene, clothing cleanliness, and all of those things. And even if we got them to improve and do a lot of good things, they found it difficult to maintain those controls. And this was a struggle we were having nationally, and we were still seeing silicosis. Ministers were briefed around that, and due to those increasing cases, the Work Health and Safety Ministers nationally decided that they were going to take the step of banning engineered stone if it contained more than 1% of crystalline silica. And it did contain, typically at that time, 90% or more crystalline silica. It was essentially a crystalline silica-rich material that was used. So it was a really big decision. Australia, I think, was the first country to do that, and it was taking, the ultimate control of eliminating that hazard, because they weren't convinced, the ministers weren't convinced that that we were otherwise able to get the controls effective enough and maintained well enough to actually eliminate silicosis, and they weren't going to accept the rates of silicosis that we were seeing, or indeed further cases of silicosis. So what happened as a result of the ban is we have seen the emergence of alternative engineered stone materials that do have less than 1% crystalline silica. First, we saw, as work was happening in this space, we saw products with less than 30% crystalline silica, which was obviously a big improvement, but it did come down to these low silica products. And I think that that is a great benefit to Australian workers. I think it's something that other jurisdictions might want to consider. The technology is obviously there now. We are very conscious that new materials may have different risks, and Safe Work Australia's been tasked with ensuring that we understand the risks of alternative materials. We also, of course, are very conscious that silica is in so many other things, and tighter laws have been introduced for crystalline silica substances elsewhere as well. What's happened with that is there's been requirements for silica risk control plans, further training, and in some cases air and health monitoring due to these further laws. So what we're looking at there with crystalline silica substances generally is a very wide range of materials, everything from natural stone through to asphalt and concrete. So these laws are really wide ranging. When we're looking at those laws, they apply when there's a processing of those materials, which is again defined really broadly with an intention to pick up those things that might cause dust. In terms of the expectation, we're expecting under the regulation that the duty holder identifies processes that are reasonably likely to result in a risk to health, which are defined as being of a high risk. So when that's the case, the additional duties apply. And in assessing that risk, the duty holder can consider higher order controls such as isolation or engineering controls, but they're not able to consider respiratory protective equipment. And the reason being that there was concern about the level of reliability of that and how effectively it's used, or how ineffectively it's often used, to be frank. The duty holder also has to consider what they know about the airborne levels of respirable crystalline silica and whether or not those levels are reasonably likely to exceed half of the exposure standard. And they must consider all of those factors collectively in making their assessment. So any processes with crystalline silica substances must be controlled to manage dust. I personally think that there's still so much work to do even on that basic level. We do still see practices going on where dust is simply not being controlled. Things like concrete cutting or brick cutting, tiles, and all of those kinds of things with some really basic hazard identification would show that there's still an issue. So from a worker health perspective, addressing these gaps are a priority. We've got a very dynamic workforce in some of our crystalline silica work. We've got a lot of Australians are born overseas and they've come from different backgrounds. There's different languages in the workplace. So in terms of getting effective communication to people from all different backgrounds and languages, that can add a little bit of complexity as well. So it's definitely a national priority. There's national model guidance available about the engineered stone prohibition and about working with crystalline silica substances. And there will be a crystalline silica substances model code of practice as well. For those in mining jurisdictions in Australia, there are some legislation differences. In Western Australia, due to requirements that are already there in the law for a detailed health management plan, there hasn't been an application of the crystalline silica substances laws, but there are still strong health management requirements for the mining sector. Okay, I'll just speak a little bit now in terms of the role of the Asbestos and Silica Safety Eradication Agency and their role coordinating asbestos and silica work nationally. So I think I mentioned a little earlier that over a decade now, we've had something in place in relation to asbestos management through this agency, and it has been expanded. ASEA, as the acronym shortens to, it's not a regulator, but it does provide a really important mechanism for national planning, coordination, provision of information, acquiring research or actually commissioning research and reporting on national progress in these areas. And as an example, the one that's more embedded is the asbestos plan. There's been a national plan in place there for some years now, and you can really see that progress is being made through taking this more holistic look at asbestos rather than in the past where it was very much a more siloed approach, and workplace laws were taking one path and environmental another, and there wasn't really a place to see how all of those things fit together and the aims that all of those things were driving towards. So yeah, it's a really important role there. And it does involve, of course, so much partnership with government at different levels. So there's partnership and information sharing with all the jurisdictions, and within those jurisdictions with different bodies and regulators. So there's a lot of coordination, there's a lot of reporting, and I'm sure all of those things are a big challenge for them, but that's what helps break down those barriers and provide that holistic approach. In terms of the silica plan, this is a very new plan, and it was endorsed in late 2024 by all of the jurisdictions, and it's now available on that ASEA's website. So some of the aims that they're looking at there, and of course I've mentioned that the ministers really want to make sure we eliminate silica-related diseases in Australia, and I think that's absolutely feasible, that we need to be doing that. And as part of that, we're working toward improved worker health and wellbeing. Of course, with silica, a lot of this work is happening in the workplace, so workplace risk reduction and the broader education and awareness are all part of that first aim. And the other aim is to make sure that we are supporting workers and others and making sure that diagnosis and treatment are optimised as well. And the third one is Australia does want to provide its, share what it knows globally to see if we can influence safety in other jurisdictions internationally and support, if you like, improvements in worker health at that level. So the actual Asbestos Safety and Eradication Agency does take a lead on that item. Safe Work Australia will lead on items such as legislation, and ASEA does coordinate jurisdictions as they develop state plans and goals that actually underlie this national plan. Similarly with asbestos, we're now up to the third phase of a national plan for asbestos. It really builds upon past plans, and it addresses the risks in the workplace and for the public health as well. So again, we're aiming here to eliminate asbestos-related disease. This is very much a long-term goal, noting the long latency of these diseases, but it is where we're heading. And again, over time, it's where we think we are able to go. But what that relies on is that we actually really know where our asbestos materials are, that we're very clear about that, so we're not inadvertently exposing workers or the public to asbestos materials. And as part of that as well, we want to make sure that we're consistently doing our risk assessments to a standard, and that's been a bit of a focus lately. Prioritised removal, look, it's a controversial area because asbestos removal is a big decision. It's expensive, it has risks, it needs to be well managed. But in the longer term, we've banned asbestos now for 20 years. So all of our asbestos in our workplaces and homes, if it's still there, it's pretty old and it's getting older. Its condition is only going to deteriorate as it gets older. And so we do have to actively think about prioritised removal and plan. And of course, once we've done that, we've got to have those systems for transport and disposal. Similarly to silicosis, we want to make sure workers are supported as best we can, and that we're continuing to work on improvements in diagnosis and treatment. And of course, internationally, the agency, IOHA, is taking a lead on promoting the Australian position in terms of banning asbestos. We'd like to see it banned globally, and we want to ensure that countries that are interested in this are supported in taking that approach. And we're also quite active in terms of making sure that if materials are coming in that might have asbestos in them, and it's actually a prohibited import to this country, that we're identifying that and we're taking action around it. So a few years ago, as an example, there was a hospital getting built in Western Australia, and it turned out that the new building material that they had acquired and brought in, unfortunately, and I think probably that they weren't aware that that building material, which was a roof panel, had an asbestos component in there. And it was a pretty big job that they were involved in, and unfortunately they had to take those roof panels apart to make sure that they'd removed that asbestos because it was prohibited. It was not permitted to stay and be part of this new building, so it was removed with some cost and resource implications for that piece of work. Interestingly as well, IOHA is going to keep working on improved technologies to identify asbestos to make sure we can do that as effectively as possible. And they're also talking about reviewing the asbestos workplace exposure standard, which hasn't so far been addressed as part of the large piece that Safe Work Australia has done. We're also looking at whether our current asbestos removal training is what it needs to be, or whether that needs to be improved, and where IOHA is seeking to facilitate further research, particularly into lower level asbestos exposures and what those risks look like. So there is a lot in this plan. It is available again on that website of IOHA, and jurisdictions, including Western Australia, we'll be developing an underlying plan. So we're still working on that here, consulting our stakeholders and figuring out what are we able to do that will actively contribute to this, because we'll be consulted and we'll be reporting back nationally, and those reports will be published. Okay, so in terms of the National Occupational Respiratory Disease Registry, this is a pretty new process to report on respiratory diseases. And the requirement is that occupational and environmental medicine physicians and respiratory and sleep medicine physicians are required to notify this registry if they have a disease, if they diagnose a disease, which is mandatory to report. And at this stage, that's just silicosis, but in Queensland, there are a few others that are notifiable as well. So in the period, what I've got up on the screen here is the information for the period between when they commenced operating in May last year through until August, and there'd been 22 cases of silicosis and 6 cases of other diseases at that time. So it's emerging information, and as a regulator, we're able to find out if there's silicosis occurring in Western Australia, where's that been occurring, and then we're actually able to deploy some inspectors to have a look at that workplace to see, does that relate to risks that are actually still problematic at this time? Do we need to take compliance action around those risks? Or is it due to, something that's a bit more historic and actually the risks have already been addressed? So it's going to be really useful information. I mentioned at the introduction around workers' mental health. So there is ongoing work in this space by Safe Work Australia. And from an occupational hygiene perspective, the Australian Institute of Occupational Hygiene identifies that it's the anticipation, recognition, evaluation, control, and confirmation of protection from hazards at work that may result in injury, illness, or affect the well-being of workers. So that is a very holistic definition, and it means that some occupational hygienists might currently or might in the future have a role in assessing or controlling psychosocial risks. So between 2017 and 2022 in Australia, we were seeing something like a 37% increase in work-related psychological injury claims. Some jurisdictions are looking at those accounting for about a third of workers' compensation claims by 2030. We are struggling a bit in Australia with symptoms of burnout, other symptoms like exhaustion, cognitive load, and emotional impairment as well. So there's a lot going on. Safe Work Australia's drafted a code of practice in relation to workplace fatigue, which looks at physical, mental and or emotional fatigue and hazards such as working hours, shift design, equipment, environments and so forth. So work will continue on this, and we're looking forward to having something that may well be published later this year. Additionally, Safe Work Australia has produced a model code of practice on sexual and gender-based harassment. Unfortunately, Australia still sees too much of this kind of behaviour. I've seen international surveys and results, and it does show that we definitely still have some issues in this space. This code of practice is intended to provide that workplace context about these risks and what businesses can do to reduce those risks. How can they recognise them? How can they understand them? So we're looking at things like sexual harassment, gender-based harassment or discrimination, hostile working environments on the grounds of sex or gendered violence. Additionally, there has been a tool called the People at Work tool produced and available. I'm not quite sure at the moment where the future of this tool will lie, but it has been well used as a free tool available in Australia to do a bit of an assessment of psychosocial risks, as it has been evidence-based, it's a survey-based, and it's a digital platform. So it contains some online learning modules and so forth. But what we are seeing in Australia is lots of different, I guess, approaches to doing these risk assessments. The codes of practice I see in terms of consultancies that are supporting businesses in doing those assessments. There's also discussion around setting up a national centre for mental health and wellbeing in Australia. So it's in its foundational stages, and the idea being there that it would collaboratively develop integrated workplace mental health, safety and wellbeing, innovation and research. So it would be connected up with research organisations and supported to try and provide that national I guess, opportunities for streamlining, and instead of such work being done all over the country in different places, it's a way of bringing it together and I guess harnessing the opportunities to work together and be efficient. As it would be an independent centre, it would be able to work on issues that might be on the fringes of work health and safety laws, areas that might overlap with broader mental health issues that might go into public health or might go into human resources. So psychosocial risks, they're not perhaps core occupational hygiene, but I think it is really important to start to get an understanding of that. I also think it's an issue for leadership. So if you're, you know, it might be something you can support your leader with. It might be where you are a leader and you need to be across these issues as well. So certainly, you know, having codes of practice, having supports around that, I think is helpful. And AI, it's been a big moment this year for AI. It's been very much in the news. The use of AI has certainly been accelerating, and many people are using it. It's been taken up enormously quickly, and I think that seems just to be accelerating. So there can be some really good examples of productivity boosts, and for that reason alone, people probably want to be using it. They're probably very interested in it. When I go back to the issues of overwork and burnout, you can see, well, there'd have to be opportunities in it. So for those of you that haven't used it yet, you probably will at some point, whether that's in a work trial or whether your colleague shows you some amazing tool. So it's something that we'll probably all have more to do with going forward. In Australia, there are some policies and guides available, and I think that, you know, we all hear a lot about risks as well with AI, and going back to principles and policies around how to use it safely, how to use it fairly, how to make sure we're not adding to the risks to workers' health. And there certainly are those kinds of risks. And again, you might have come across situations where risks have been introduced. So if we are going to use it, how do we be really transparent around that, fair around that, provide people's health protections like data protections, and be really clear that we're taking ownership of decisions that we make when we're using it. because while we might use it as a tool, we've also got to own the outcome. We've got to own the decision. We've got to own the risk. So it's a matter of being aware that this area can impact worker health. We've seen some unfortunate examples of the use of technology to make government decisions where it has impacted on the health of those affected. So it is a real issue. It's not just a theory. We've seen harm come out of it, but I'm sure we've seen a lot of positives come out of it as well. We just have to be extremely accountable as to what we're doing in that space. And just reflecting back on the role of regulators, as a regulator in WorkSafe, we use a whole range of different tools, which are shown in the pyramid here. And the tool that we're able to reach most people with is encouraging and assisting clients. So providing information, guidance, education, that in that way we can reach people in all different parts of this very large state that we're in, and through multiple different forms of communication that might suit the way they like to consume their information. So it's really something we need to do more of, we need to get more effective with, but it is already a big area. Directing compliance, we've got inspectors who are shown in the photo there, a whole heap of our WorkSafe inspector team, and they're able to take compliance action, whether that's in the form of issuing compliance notices, which require improvements to be made, or collecting evidence for higher level sanctions, such as revoking authorisations or taking evidence that may be used in a prosecution. Prosecutions are a smaller piece of the work, but they are important because we do think that the awareness that we get through prosecutions, the broader communication around that does send a deterrence message. We think it does motivate some of our stakeholders. I think people in workplaces are a very diverse group of people. They're motivated by different things, and having this mix of tools is an important it gives you important options and gives you the options to choose tools that send different messages and target areas that you might be having issues and problems with. So they're the tools that we've got available, and I'm aware that internationally not everyone's got the same ones, and you might have more limitations around what you've got available. They can all still though have really useful effects. In terms of things that are working well, I think in Australia at the moment, firstly, because we've had, unfortunately, a range of national issues, whether that's dust diseases, whether that's, around COVID, it's highlighted that there is really important need for expertise in terms of worker health. So there's certainly some awareness, there's certainly some profile around these issues at the moment. The community has an expectation that their workplace is going to be safe and healthy. They've got an expectation that there should be a regulator. We do try and meet those expectations with a risk-based approach and risk-based strategies, but we know we need to keep improving. What is also working well, I think, is the tripartite approach and being as constructive as possible and trying to work together as effectively and constructively as possible to get all of those inputs to get an approach that's as usable but also risk-based as possible. The image here is from our commission, which is one of our tripartite groups, but we've got it happening at different levels. And as part of that is the genuine commitment to seeing improvements of all of their people that are participating in the frameworks. The harmonisation principle for organisation for jurisdictions or countries that have some government complexity, I think it's a useful principle to think that you can harmonise and you can make things a little easier and a little less complex when you do harmonise. So while it's an ongoing piece of work and it's not easy to take a harmonised approach, I do think it has benefits, and I think Australia is committed to harmonisation and is committed to keeping on working on it, even though, as I say, we don't always achieve it as well as we'd like, but we're committed to keeping on working towards it. In Australia in recent years, the role of occupational or industrial hygienists has also been highlighted through various issues. We are hearing more from people in the profession. The role is better understood, and I think that's important because people don't know, going back 10 years, we were trying to raise awareness of occupational hygiene as a profession so that people knew to look for a hygienist when they needed help with the worker health issues, and that's something that we have seen progress on over the time. And we've got a mix, I think, in terms of our policy and partnerships, a mix of regulators, a mix of policy organisations, and partners from different backgrounds. So then in terms of what could work elsewhere, I mean, we're a fairly highly regulated sector in Australia for work health and safety, and this, of course, may translate to some countries internationally, but not to all. Some lower to middle income countries might have less regulations or minimal regulations on some of the worker health issues we're talking about, and would need to select, you know, some of the different options. So national strategic plans are one of those things that might work for other issues. We've seen how that has worked well with asbestos as an example, and how it has brought about change. And also the use of those national standards or national codes of practice that may work in a less regulated environment as well. But importantly, understanding the scope of the problem. What is the problem? What is the biggest problem for your country in terms of worker health? Where do you want to focus limited resources? We've all got limited resources. How do we choose where to use them? In understanding that, I think education of doctors is something to consider, because they're often seeing illness, seeing worker health issues. How do they know to ask the questions around what might relate to work? How do you help doctors who are very busy people with lots on their plate? How do you help them ask the questions around work relatedness that would perhaps inform your sense of the scale of the issues? Having reliable data is such an important piece of taking a risk-based approach to a problem. Keeping ministers well informed is another thing that can work across the board. Ministers, you know, really have to be well informed if they're going to also understand risks, but also benefits of the possible approaches that are out there. They should be, you know, informed, so they do understand that, and they understand what resources are currently deployed on these issues, so that they can, you know, do the work that they need to do as well. We find that if legislation change is needed, look out, I don't know if we're efficient with these things or not, but we find that it takes at least a year or two, even with the best of intentions and motivations in our complex environment. Even things like national plans also take similar time because of the amount of consultation and input and the complexity of all the people that you need to consult with. So we don't find that we're super fast moving on these things, but over time it does make progress. If there's technology involved, like online reporting, again, we've got quite some complex situations, and it makes us even slower if those are involved in Australia. You might find that your country is actually more agile in that area, but we find it's something that does take us quite a long time. So overall, I think just being strategic in prioritisation, looking at both the longer term frameworks of how you're set up from a legislation or guidance approach, and where that might go, how that might evolve in your regulatory framework, as well as how to address immediate issues if you've got any right now worker health you know, serious problems and issues. How can you concurrently take some action right now, as well as evolving your framework for the future? So thank you for being here. As I shared that information, I've provided a little bit of contact details on this slide, and I'm very happy if there are some questions that we might like to go through. Thanks.
Okay, thank you very much, Sally, for all of that information. It was there's really a lot going on, a lot of good initiatives, and a lot of continuous improvement in Australia and in Western Australia. So thank you for that. There are a couple questions. There's one in the chat box, one in the Q&A. So I would encourage others to continue to put those in as we go through. In the chat box, we've got from Lawrence. Is there a national population-based cancer register for asbestos-related disease, including mesothelioma, or a registry by state? There's a lot of parts to this question. Do you want to start with that part?
I'll start with that part. So there's a there's a document called Mesothelioma in Australia, and that's essentially a national registry of mesothelioma, and so that's published annually. It's the primary source of information on mesothelioma in Australia. It contains some statistical breakdowns of the cases of mesothelioma, so that is a valuable source of information. However, going a little bit more broadly into asbestos-related disease, we quickly get into some much more tricky territory, because when we go to lung cancer, because of the wide range of potential causes of lung cancer, we're not as easily able to pull out or attribute the cases of lung cancer that might be related to asbestos. And that's where we look at things like research papers and some of the publications on the Asbestos Safety and Eradication website and the estimates that they've done. So it certainly gets a lot more complicated once we move away from mesothelioma.
Okay, okay. Thank you very much. The next part of that question is, do you have an estimate when occupational legacy asbestos will be reduced to some reasonable level?
Oh, wow, that's a really good question. I'm not really sure. I know in Western Australia, when we look around this state, I can see, so the ASIA's done some really good heat maps. The heat maps show where we've used asbestos more geographically, and so they've got information on their website about that. So it is really useful, and we'll keep monitoring that. And what we're seeing is that certainly in the metropolitan area, due to issues around real estate and redevelopment and the value of land and all those things, there's quite some turnover of asbestos properties and so forth in the metropolitan area. In the regional areas, it's a lot slower, and so the percentage of asbestos materials in regional towns, country towns, remains a lot more slower moving, and so it's, to me, going to be a much more lingering issue in those regional areas. And then you get the more complex buildings and structures where, some components might be very difficult to remove when the building is being occupied, and it might really be when we demolish kind of situation, but they tend to be a bit less common. It is a big investment though. We've seen some fabulous projects, like one of the big fertiliser companies in the industrial area in Perth had such a huge amount of sheds, the fertiliser and related sheds, and just over years were doing an ongoing process where they were just removing it slowly but consistently year on year on year, and just really investing in it. And we've seen some government agencies with an annual removal program. But that's where we want to go with the national plan over time, is to get a better understanding of it. But we're definitely looking, I feel like we're definitely looking at decades to get it down to what might be a more reasonable level. We've been a very big user of asbestos materials in Australia, a huge user of them.
Great, thank you. And I'm not sure, based on that, if you can maybe answer the next one, but given how can I ask it? So if, based on what you've just mentioned, is there any estimate, given the legacy asbestos that needs to be remediated, when asbestos-related disease can be eliminated?
It's probably the answer to the last one, which was hard to answer, plus 30, 40, 50 years, because we're seeing that the latency can be up to 40, 50 years now. We're seeing the people that are getting mesothelioma, and also the population's aging. So, they're living long enough for that diagnosis to unfortunately occur. So there's quite an aged cohort that's represented in the mesothelioma cases. So yeah, it's probably the date when we've got it down to a reasonable level, plus 40 to 50. It's a long time.
Right. Thank you. Good. And Lawrence was just saying thank you, and he realizes these are difficult questions that require many levels of collaboration, but any pointers are helpful, so thank you. In the Q&A, we have a couple other questions. Someone had asked actually of the silicosis cases that were notified, how many came from mining, but I think you put up a slide that had that answer, and
the
question's not there anymore.
Yeah, I can
Yes.
say that for Western Australia. So in Western Australia, since 2018, I'm aware of 56 cases of silicosis in total. 50 of those relate to engineered stone, 3 relate to mining, 1 relates to fire doors, and I think 1 or 2 were foundries.
Oh, wow. Okay.
Yeah.
Thank you.
And we're going to do some more research on, because we've actually got some data as a department around air levels, exposure levels in air of people in the mining workforce over some decades. So we're continuing to work through that. People working near crushers and so forth are higher risk. Yeah, we're continuing to try and do some further risk analysis and see if we can get a better understanding of the risk profiles of the different cohorts from historic mining in Western Australia as well as current.
Yeah, yeah, very good. I also popped a couple questions in the chat, and one that I would like to hear about, and maybe some people on the call as well, is if you have any advice for professionals that are wanting to get in touch or reach out to stakeholders in their jurisdictions. For example, we've got a couple member associations that are really forming to bring attention to the profession and to maybe get the attention of their government or the regulator. Do you have any advice for those groups that might be wanting to get more involved and build relationships?
What I've noticed with the Australian Institute of Occupational Hygienists, because they've raised their profile over the last probably 5 years, is a number of things. So one of them is their media profile. So they put out some media statements when there's some issues, worthy of those things, with some big issues going on. And as part of that, they've actually identified several members within the leadership of the group who are willing, if you like, to be media spokesperson. So whether they give them media training or they've already had that or they are already good with media, they've identified several spokespersons. And in that way, they've actually been able to respond to queries and some of their members have been on TV or radio and so forth and actually share some messaging. They've also put their hand up for, to be involved in events and speak at events, as well as kind of the formal mechanisms of writing to bodies that they're wishing to influence or be involved with. So writing to ministers or to government seeking to be involved on consultative arrangements that are being put out through government. So probably not that non-traditional, but it has worked for them. I think it has worked and they've definitely raised their profile.
That's great. Great. Their media ambassador program is very impressive. That's something I think as a profession we should really think about for all of our national associations.
I think it does. I think it does work. Yeah.
I did see you may have answered my next question. I was going to ask where you bring practitioners in, so like from professional organizations or people from the field. And I saw your commission, actually. I saw the famous face of Tracy Benz on there. And so that's a good example. Do you have other like working groups maybe, or how do you call on practitioners?
Great. So part of our tripartite groups, we have expertise on the group. So we have some people from occupational hygiene or from some of them from university research roles and so forth. So we do a little bit of that. We've also got we employ occupational physicians within the regulator, and so we also the health monitoring piece in Western Australia. We've done a lot of work around that, around what does good health monitoring look like. The occupational physicians are a critical input into that and really quality kind of manage that. And then they reach out, engage with doctors that are conducting health monitoring and really provide educational events for them. So we do presentations, we get those doctors together, we explain some of the risks and challenges and issues around health monitoring and what good looks like. So we do try and engage them and get good practice because, of course, sometimes disease goes under the radar because while people are looking for the disease, they're not actually looking effectively. So one of the things we've done in Western Australia, we've introduced low-dose CT scans for the health monitoring for silicosis, whereas it used to be a chest X-ray. And when we did a bit of a program for that, we actually identified some high-risk workers who'd been working in engineered stone. They'd had a chest X-ray. This was a few years ago. The chest X-ray didn't identify any silicosis. We offered 100 of those workers a free low-dose CT scan, and we identified something like 7 or 8 cases of silicosis. It was there, but you couldn't see it on the X-ray, but you got a much better picture with your low-dose CT. So we changed the legislation. So now you have to use a low-dose CT. We get a lot better image of what's going on with their lungs. And the doctors, the physicians, have been a big part of doing that.
That's great. A great example. Good, thank you. Maybe the last question maybe we have another one. I see some new posts in here. Are there any examples of sort of non-traditional partnerships that that you've sought out? And maybe some traditional ones could include like lawyers or engineers, or it's not exactly they don't sit around the table all the time, but do you have examples of partnerships that you've built that have brought Western Australia a bit further in their aims and objectives?
We try and be, what's the word, a little bit open door, and we certainly meet with lots of different people from industry, all different industry groups, traditional and non-traditional industries and emerging groups. One that we found a little bit hard, and certainly traditionally they don't like to be engaged with us, is farming. We find that farmers don't really like to be regulated. They like to be independent people doing their own thing. But what that means is they've got the highest risk profile of any kind of industry in Australia. You're about 9 times more likely to die at work farming than you are doing average other things. And so we have put a committee in place around that. We've tried to get representatives from like the Shearing Association, the farming associations, and different groups that can try and influence that. It is still a challenge for us, because I think tradition around how they like to work and how they like to think about risk, we're trying to kind of reshape that a little bit, and it is a little bit of a journey, but it's one that we're continuing to engage in and trying to really do a bit more of a heavy information focus with that sector. It's pretty light on the prosecution work generally, and it's pretty heavy on the here's information, here, talks and going to events. We go to farming field days and so forth, where they have the tractors for sale and all those kinds of things, to try and reach different groups of people and get that particular high risk group, to engage with us to some level.
Yeah. Oh, very interesting. Thank you. We have a question from Robert, and that is, thanks, Sally. Will WorkSafe be releasing any guidance information to assist businesses seeking to comply with the revised workplace exposure limits that are approaching or below the limit of detection for current monitoring techniques?
Look, we're continuing. We'd like to see that kind of thing nationally, because that's not going to be a WA specific problem. It's going to be a national problem. There's a few substances that are on that list that are still in play. Diesel is another one that we're looking at as a specific standalone case in Western Australia, because there's been a few concerns raised about the proposal for where we're going with the diesel workplace exposure standard. So you'd like to promote that kind of research will be done through Safe Work Australia in the first instance, and that kind of guidance would come out through there. But if, like a lot of things, we've got to keep monitoring the situation. If we see some WA specific kind of challenges, then absolutely we'd like to hear from our stakeholders. So if there's people here on the line from WA that want to say, look, we've got specific challenges in that type, we're happy to hear from you and to consider what we might need at a state level.
Very good. All right, that was our last question in the chat. If anyone has anything, please do send it in. And with that, give it just a second. I think that might be the last one. Sally, I would like to thank you. I can really appreciate all of the work that WorkSafe in Western Australia is doing, and I especially really liked in your pyramid that on the bottom you had encouraging and assisting with compliance, and I think this is a really impressive way and to support and build partnerships as well. So thank you for sharing your time and your expertise and experience with us. Very much appreciated.
Most welcome, and thank you to everyone for joining.
All right, thank you. Bye-bye.